Giving your child enteral feeds and medication. Programming the feeding pump. Press the power button and hold to turn on. Press the arrow on the left to continue using the previous program or to clear previous settings and enter your child's feed rate. Press arrow on the left to adjust feed. Select Feed Rate. Use arrows on left to enter rate. In this example, the feed rate is set to 45 milliliters per hour. Press the top button on the left, Enter, when rate is correctly set. Now, back on the Adjust Feed page, select Feed VTBD. This means volume to be delivered, or how much formula your child should need for 4 hours. This is because formula expires after 4 hours at room temperature, so this will be your reminder to refill the bag if your child is on continuous feeds. Press the top button on the left, Enter, when the volume to be delivered is correctly set. Back on the Adjust Feed page, select Done. Now it is time to prime your feeding bag. To prime is to get the air out of the tubing. Load your tubing into the pump. Fill your feeding bag with at least 4 hours worth of formula. Ensure that the tubing is disconnected from your child's stomach tube before you prime the tubing. Remove the clear cap from the end of the new feeding bag and tighten the end pieces. Press the button on left to prime pump. You can use auto prime or manually prime by holding arrow button down. Once the tubing is fully primed with formula, you can press Done and return to the pump home screen. Attach the primed feeding tube to your child's stomach tube. Be sure to clamp the tube prior to opening the tube port. Your child's stomach tube may look different, but always follow instructions for G-tube, J-tube, or NG tube. Once the feeding bag is connected, you can unclamp the tube and press Start. Giving a medication while your child is receiving continuous feeds, G-tube. To give a medication while your child is receiving continuous feeds, first press hold on the feeding pump to pause the flow of formula. Be sure to clamp the tube prior to opening the tube. Open the smaller port and attach the syringe with drawn up medication. Unclamp the tube and give medicine. Clamp the tube before removing the syringe and attach your water flush. Unclamp again and flush with a small amount of water, approximately 5 milliliters, after giving medications. Clamp the tube, remove water flush, and close the smaller tube port. Unclamp the tube and restart feeds on the pump by pressing Run.
Updated enteral tube devices, ENFit. Your child's enteral tubes may look different than seen in these videos. Here is an example of the ENFit device, a product where the connection pieces require a twist-on attachment. There's no difference in how feeds or medications are administered. A connection piece may be needed in order to properly connect ENFit devices with different syringes.
Giving a medication while your child is receiving continuous feeds, NG tube. For the child with an NG tube, first press hold on the feeding pump. Be sure to clamp the tube manually prior to opening any ports. Open the smaller port and attach the syringe with drawn-out medication. Release clamping of the tube and give medicine. Clamp the tube before removing the syringe and attach your water flush. Unclamp again and flush with a small amount of water, approximately 5 milliliters, after giving medications. Clamp the tube, remove water flush, and close the smaller tube port. Unclamp the tube and restart feeds on the pump by pressing run. Your device at home will look a little different and be slightly smaller for easy placement within a backpack for your child on the go.